This conference will now be recorded.
Okay. Hi, everyone. In case you've just joined us, welcome. My name is Dr. Bhavna Sharma. I work as endocrinology registrar in NHS London, and I'm a part of the Teach Your team. This is going to be a brief session that I just wanted to cover summarizing on OET speaking, because I think when we conduct our mock test with Teach Your Academy, the part which most students struggle with on their OET speaking on our mock test as well as in the real OET exam is one, introducing yourself, and the second, which is summarizing on the OET speaking. So I've covered introductions before as well. So if you go to our YouTube channel, which is by the name of Teach Your Academy, you should be able to find ways to introduce yourself on OET speaking. And on our last session, we covered about using your first 3 minutes to the fullest extent when you're preparing on your OET speaking. So that's another useful session. But what I want to do today is I want to talk about summarizing, which is basically how you conclude your OET speaking discussion. So just to get a sense, what do you guys feel is summarizing on OET speaking? If you can type into the chat window as to what do you feel is summarizing on OET speaking, and if you actually use summarizing when you're practicing your OET speaking, or if you've attempted OET speaking before. Have you ever summarized your discussion before? Please type into the chat window and let me know your thoughts. Okay, so basically, what I feel about is summarizing is that when you're ending your OET speaking, what everyone should do is most of the times you get finished with your OET speaking in about so it's usually what happens in your OET speaking is you get about 5 to 7 minutes depending upon your interlocutor, but most students, they finish their scenario in 4 minutes or 4.5 minutes. So what they do then is that they sit in front of the examiner waiting for their time to end. Now that is actually quite a bad practice, because remember, you want to show your examiner that you've got a very wide range of English knowledge and you've got very good clinical communication skills, and you want to pass on your attempt. So in order to maximize your chances of passing, if you have any time left at the end of your OET speaking, then what we recommend you to do is you need to practice the act of summarizing. So basically, summarizing means that whatever you've discussed in your 4 or 5 minutes with the patient, you're going to conclude that by just forming a concise and a precise description of what you told your patient. Okay, so it's basically when you're reading a chapter, when you're reading a book, or you're reading a chapter on a book, usually at the end there's a synopsis or the key points which have been emphasized on by the authors are just written at the end, and it's a very small sort of a section, but it's actually something that the examiners, they find the most useful in order to evaluate your English. So if you've not summarized before, Isha, I think you should try and um, see this session, look at if you've got time left on your OET speaking when you're practicing. And depending upon if you've got time, try and incorporate this practice onto your OET speaking. Okay, so let's just look at what summarizing might be useful for. So it's a good conclusion to any discussion. So what students sometimes do is that they've told this patient that you've come to the hospital, we've done this investigation on you, the investigation showed you have a pneumonia, we're going to give you antibiotics, and I'll see you in 2 weeks' time. And then they finish and then they say, okay, thank you. So that's actually quite bad clinical communication, because you ended your conversation on a very abrupt moment and you didn't really allow your patient to give you an opportunity to sort of rediscuss or sort of discuss things again which they've not really understood. So summarizing helps you with that. The most important thing that I find on the OET is that when you're summarizing, you're basically going through everything which has happened during your OET speaking. So you're going to say, okay, so today we discussed about you coming to the clinic with complaints of recurrent abdominal pain. When I examined you, I found that you had a lump at the upper right quadrant of your tummy. We also talked about the further investigations which need to be done. And we talked about certain diagnoses which might be probable at this point. Now, while you're doing this and you're sort of telling your patient whatever you've discussed, you might be looking down at your notes, okay? Then you might see something that you miss. So you're talking to your patient and you're looking down at your notes at the same time. So this is actually an excellent time to pick up points that you might have missed. So for people who struggle with long tasks and they miss out points on their long task, summarizing is a very good method of just making sure that you've covered everything, because not only is it a revision for your patient, it's a revision for you on your speaking task. So very, very good advantage of summarizing on OET speaking. Remember, on your OET speaking, when they're judging you, they're looking for clinical communication criteria. And one of the clinical communication criteria is information giving. Okay, so when you're giving information to your patient, a very good method of enhancing your score on the information giving category is summarizing in a language which your patient is going to understand. And while you're summarizing, try and tell the patient that, okay, I'm going to now summarize our discussion today. If at any point you feel like there's something which has been missed out, please do let me know. So with that simple line, you're going to tick the box that you've made your best effort to get as much information as possible from your patient. You aren't a doctor who's going to speak for a very long time and not let the patient give their opinion. You're someone who is again making an effort at the end to see whether something has been missed out, which your patient wants to tell you. So it's going to increase your clinical communication criteria quite rapidly. Good way to show off your language. When you're summarizing, now what I'll do today is I'll give you a cheat sheet of what an ideal summary would look like. And because it's a cheat sheet, you can actually use that on each and every OET speaking. And all of these will be grammatically something that you've already looked over, and the possibility of you making grammatical mistakes are much lesser when you're summarizing. And remember, when somebody's listening to your recording on the OET speaking, the last impression is very important. So even if you've performed a little dodgy in the middle or in the start of your conversation, if you give your examiners a good summary with good English and perfect grammar, that's going to increase the chances of you passing quite rapidly. Okay, so this is just a way of trying to enhance your score on your OET speaking. Now that I've said that it's a way of enhancing your scores, lots of students ask us, why is it that if I don't summarize, will I fail my OET speaking? No, you're not going to fail your OET speaking if you don't summarize. It's definitely not something which is completely necessary to pass, but it is something which is going to increase your probability of passing. It's not necessary that if you've got about a minute left that you cover each and every point. You have to make them concise and precise. So you don't have to say, okay, we found that your white cell count was increased. Okay, we found that your alkaline phosphatase was increased. Okay, we found that your calcium was normal. So you don't need to mention everything. You might say, we discussed your lab investigations and we found that you've got raised inflammatory markers, but the rest of the investigations are normal. Okay, so you don't need to cover each and every point because you want to give a very nice overview of the discussion. You don't need to do the discussion again. Now, some students, I don't know where they've learned it from, they have started asking the interlocutor to summarize. And I've seen this in a number of students that we've tested over the past few weeks, that they ask the interlocutor to summarize everything in their own words. Remember, this is your exam, it's not the interlocutor's exam. So you don't want to give them such an open-ended question, and then what might happen, the first of all, which is most likely what will happen, is that the interlocutor will say, no, I don't want to summarize. Or what might happen if the interlocutor has not dealt with this before, they might start talking and they might take about 1.5 minutes of your precious time at the end, which is basically just the interlocutor talking. So the examiners don't want to listen to the interlocutor summarizing. They want you to do it, okay? So that's something that, guys, please be very cautious about. You don't want to do that on your exam. Okay, so that is basically summarizing with an overview as to what summarizing is and why not is it important. Now I'm going to move on to the cheat sheet, but before I do that, guys, if you have any questions with regards to what we've discussed till now, please let me know. Otherwise, we'll just move on. Okay, good. All right, I'm going to move on now. Okay. Now, if you are not familiar with Teacher, the way that we do this is that sometimes we give you a cheat sheet, which is basically like a basic format, which you can adapt for yourself on your OET speaking or on your OET writing, but it makes your life very easy to sort of have a skeleton of things that you can use on your OET speaking or your OET writing. Now, I'm not saying that this is what you're supposed to completely copy and give out on your OET speaking. You can modify this up to according to your style, your way of talking, or whatever your preferences are. But if you struggle with your grammar, I think this is a very good place to start by starting out with the cheat sheet. Okay. So the first cheat sheet, you can take a screenshot of this. And I'm also going to upload it on YouTube. So you might be able to get it from YouTube if you've missed out anything. So the first cheat sheet that I give you is how you would introduce yourself on your summarizing on OET speaking. Okay, so how would you start your summarizing? So you can say something like, thank you, Mr. Johnson. Now I will briefly summarize what we have discussed till now. Another way of starting your summarizing, thank you, Ms. Jones. Just to conclude, I would like to briefly summarize our discussion today. So these are two ways by which you might start your summarizing. Now you might do something else that you want, but this is a good place to start. Or you can just copy this and do it on your exam. It just depends upon your preferences. Now, how would you follow this up with? You can say something like, this might be quite useful to tie all the things together. If at any point you have anything to add or discuss, please do stop me and we can go through things again. So again, very good way of sort of starting your summarizing. So all good English, so points for good grammar. And because this is something that is going to be committed to your memory now, points for fluency. So you're going to be putting that, you won't have to think a lot for this, and you'll be putting that quite nicely and quite fluently on your OET speaking. So you get extra points for that. And then when you say things like, this might be quite useful to tie all things together. If you have anything to discuss, please do stop me and we can go through things again. So points for information gathering and information giving. Okay. So if you've taken a screenshot of this, guys, please type in yes, or if you're happy with this, just type in yes, because I need more audience participation. So if you've understood this, please type in yes, and then we can move on to the next part of our cheat sheet. Okay, excellent. Now, I've just made a brief sort of again a skeleton for a cheat sheet if you've got a discharge. So most of the times on your OET speaking, you get people that you're discharging from your hospital. So how would you summarize the same? I've just made that into a small sort of a skeleton. If you do this, I think that should be enough for a discharge. But again, you can add things if you want to. So firstly, we discussed the plan for your impending discharge. We discussed your medications on discharge, including we briefly discussed some lifestyle measures that can help you post-discharge. You asked me about, and I suggested that we can. So just add whatever they've asked you about and what you've given them counseling about. I will try and arrange follow-up as an outpatient for whatever you want their follow-up for. Is there anything you would like to add? So guys, just pay attention. All of this is in the past tense because the discussion has already happened. So what people do is that they pay attention to grammar and tenses a lot on their OET or on their OET writing. But when they're doing OET speaking, we often ignore grammar, including tenses. So just make sure that when you're summarizing, everything is in the past tense. It's not we discussed. This is a very, very common mistake. We discussed. So firstly, we discussed the plan for your impending discharge. We discussed your medications on discharge. So whenever somebody is getting discharged and they've got some medications, those medications are referred to as medications on discharge. Then we briefly discuss some lifestyle measures that can help you. So that can help you post discharge. Okay. And then always, is there anything you would like to add? So you can take a screenshot of this and you can modify this depending upon whatever your scenario is and if you feel like you want to say something else. But I think this is a very good way to sort of give an overview of a discharge. So if you've understood this, guys, please type in yes, and then we can move on to our next cheat sheet. Okay, good. Now we're going to move on to the examination investigation case. So often on your OET speaking, you get a case where your patient comes to you with certain complaints. You examine the patient, you do some investigations, or you plan some investigations, and then you arrange a follow-up. So how do we summarize this on your OET speaking? So you'll start with something like, to start with, comma, we discussed your present condition. You told me that you had been, it can be you have been as well. So you had been experiencing headaches since the past, whatever time they've had headaches for. We then talked about your examination, indicating that you might have some neck stiffness. We did some investigations which suggested that the diagnosis might be meningitis. In order to confirm the same, the plan from now on would be to do some blood test on you as well as order a scan of your brain. We will then be meeting after the investigations are completed. So that's one case. Now you might have another case like, to start with, we discussed your present condition. You told me that you had been experiencing upper abdominal pain or upper tummy pain since the past 3 years. We then talked about your examination, indicating that you had severe pallor suggestive of anemia. We did some investigations that the diagnosis might be an obstruction in your gullet or your gut. In order to confirm the same, the plan from now on would be to plan an endoscopy for you, which I discussed what the procedure is. We will therefore be meeting once the results of your endoscopy are available. So what I just want to emphasize is to how we, it might have been a very long discussion in the second case where this patient came in with sort of difficulty in swallowing or abdominal pain. And then you felt like they might have something in their tummy, which might be anything. It might be an obstruction caused by sort of a stricture, or it might be something suggestive of a cancer. So that might have been discussed then. But when we're summarizing, we've made that extremely concise and we've just talked about the major points of this discussion. We haven't really gone into details. What might be a potential pitfall is that when you're summarizing, you get caught again into the same cycle again. So we talked about the diagnosis might be a stricture or a cancer. A cancer is basically something which might be incurable. So you don't want to do that. You just want to create a very, very short summary of your discussion. And this is, I think, what we suggest the length should be of your summary. Okay. So guys, if you've understood this scenario, please type in yes, or if you want to ask anything, please just let me know and then we can move on. All right, great. So the next thing or the next scenario, yes, Azizuddin, exactly. This is at the very end of your conversation. You've answered all of your patients' questions and you've got some time left, and then you're using this time to summarize your discussion. Okay. You don't restart everything again. You just create a broad overview for the patient to have a little bit of clarity. Okay. Now, most of the times, the most difficult scenario on your OET speaking is when we're talking about a child and the person in front of you is the child's carer or parent. So how do we summarize that? So we write things like, To begin with, we discussed your child's present issues, including him or her complaining of whatever their complaints were. So, including him complaining of um, recurrent abdominal pain. We then discussed that the examination and investigations were suggestive of colic. Then I reassured you that this condition was not concerning and could be managed conservatively with adequate fluid intake. I advised you to please make sure that the child is eating and drinking well and does not become dehydrated or does not develop vomiting. We then discussed that the plan from now onwards to follow your child up regularly in a specialist clinic. Okay, so what we need to pay attention to is that this everything that you do in the summary, please make sure that you don't say that your investigations indicated. It is your child's investigations or the child's examination were suggestive of. Because a lot of students, what they do is that they forget that the person in front of them isn't the patient, that's the patient's father or mother. So make sure that when you're summarizing, you always mention your child's present issues, your child's examination, your child's subsequent management. So that is extremely important because you want to make sure that the OET examiners think that the English that you're speaking is not something that you've memorized, but it's something that comes to you naturally and you don't make silly mistakes. Okay. So guys, if you've understood this, please type in yes, and then we can move on to our next part. So again, one thing that I quickly wanted to mention, you can this is not something that you definitely have to write. You have to copy this word by word. If there's something that you want to add or delete from this cheat sheet, you may do so. But if you're doing so, please make sure that you check the grammar first. Either you ask a friend or you get it checked by someone, um, if that's something that you struggle with, because I don't want you to change this and create wrong sentences and then struggle on your exam. Okay, excellent. Guys, if you've taken a screenshot of this or you're happy with this part of the cheat sheet, please type in yes, and then we can move on to the next part. Okay, excellent. Now we're going to move on to a cheat sheet of summary. So you need to conclude a summary as well. So rather than saying, okay, thank you, what I would suggest is doing things like, is there anything you would like to ask before we conclude? So you've described all of that. You've talked about your plan from now on. Then before you just say thank you and stop talking, just a very polite way of ending is there anything you would like to ask before we conclude? Is there anything you would like me to cover or explain again before we conclude? Are you happy with the summary, or anything you would like any further help regarding, or anything you would like to get further explained? So, and if the patient says no doctor or no nurse, I'm very fine, then you say, okay, thank you so much, I'll see you the next time. So something like that. So that's a very polite way of concluding your speaking. And it also shows your examiners that you again got good English. You're able to talk to a patient in a professional language or a professional way. And it also shows your examiner that you are someone who has got clinical communication skills and knows how to deal with patients in their day-to-day life, And when you come and work in a foreign country, they won't struggle with you being rude or impolite to your patients. So it's going to show very good, it's going to give a very good impression to your examiners. So you always want to conclude well. Okay, so that was, I think, a very, very brief overview of what summarizing on the OET should be and how you can use it to enhance your score on your OET speaking. In case you need any further help or you want to watch more videos from our channel, you can visit our YouTube channel, which is by the name of Teacher Academy, and we've covered a lot of things on that channel. We've covered reading, listening, writing, speaking, and it's very good if you want to start preparing for your OET or you're struggling or your OET and want to increase your scores. We do offer speaking as well as writing check services. And we're trying to prioritize students who have exams in the next couple of weeks. So if you do want to enroll, please make sure that you do so as soon as you can. It's 6.99 British pound for one speaking or writing check and 29.99 for 5 speaking or writing checks. If you're interested in the same, please WhatsApp us on the number provided or mail us on teacheracademy@gmail.com. You can visit us on www.teacheracademy.com. So guys, I hope you've learned something new today and you're going to increase your speaking score using the strategies that I've given you today. What I want you to do is what I found lots of students doing these days is that they try to overcomplicate things in their head and they try and make OET bigger than what it is. It is not a medical exam, it is an English exam and it's looking at your clinical communication. Please don't overcomplicate things by talking about taking histories and doing advanced examinations and making some groundbreaking provisional diagnosis on your OET. Keep things simple, and it is extremely easy to pass on your OET if you follow a simple path. If you overcomplicate your things and you listen to 1,000 people and you devise 1,000 strategies, that's just going to confuse you and it's going to prolong your journey to come and work in the country that you want to work in. So keep working, keep practicing, and I'll hopefully see some of you working with us in the NHS very, very soon. Thank you guys for joining us today. If you don't have any questions, I'll just conclude now and then I'll see you next Saturday. And I think Manoj sir is coming tomorrow and he's going to give us a very useful grammar session. So if you're not on any of our WhatsApp groups, please text us on the number provided and we can add you to either our Telegram group or our WhatsApp group, and then you can stay up to date with these free teacher lectures. All right, guys, just take extremely good care of yourselves and your family, and I'll see you the next time. Good luck.